Good evening, everyone. Welcome. I'm Paula Mertens. I'm the Director of Jewish Family Services here at the Jewish Federation of Bluegrass. And I want to thank you all for taking the time out of your busy schedules to join us tonight for our vaccine town hall. We welcome the Lexington-Fayette County Health Department here this evening to inform us about their efforts to make the COVID-19 vaccine available and to share how they are combating misinformation in our community. Please keep your microphones muted during the discussion, and there's going to be time at the end of the program for questions. So please put your questions in the chat box and we will do our best to get to them all. Please note that this town hall meeting will be recorded. And at this time, I would like to introduce Rabbi Rachel Sabbath. She's the head rabbi at Ohavay Zion Synagogue, a Jewish institutional leader and highly sought after public speaker. Please join me in a warm welcome of Rabbi Sabbath gives our invocation this evening.
Thank you so much, Paula, and welcome everyone. It is such an honor and a privilege to be able to be here with my colleague and friend, Rabbi David Wirtschafter, and all of you. This is an important moment for our community. We call upon God, the source of all life, to remind us that above all principles and all values of our tradition is the value of life, of pikuach nefesh. And we also know that we are responsible not just for ourselves, but for others. If I am only for myself, as Hillel says, who am I? And so we commit ourselves this evening anew to work in partnership with the community, with all of the resources, in order to move this community from chayil, from strength to strength. May it be so.
Thank you, Rabbi Sabbath. That was lovely. Now I'd like to have the pleasure of introducing our co-moderator for this evening, Rabbi David Wirtschafter. And Rabbi Wirtschafter has served as rabbi at Temple Adath, Israel since 2015. Since moving back to Lexington that year, he's been focused on strengthening the temple community, encouraging collaboration throughout the wider Jewish community, and has been a strong voice about social justice issues in the Lexington community and beyond. As a mentor and source of inspiration to many in our community, we are grateful to him for moderating this evening. Rabbi?
Toda Rabbi, thank you, Paula, Bruchim Habayim, welcome everybody, and a special thanks to everybody in the public health department and to all of our doctors, nurses, EMTs, essential workers going above and beyond during this crisis. I want to acknowledge tonight that in addition to both being rabbis and both being honored to serve this community, Rabbi Sabbath and I have something else in common. We are both the children of physicians. And Rabbi Sabbath's father, was a physician, I believe, in infectious disease. And while it's sad that we lost him a couple of summers ago, and interesting to think about how his remarkable mind and professional experience would have fared during this tremendous challenge, the contributions that he might have made. It's of some comfort to know that we have his daughter carrying on his legacy of caring, of service, and of being a source of healing to so many. In addition to tonight's panel that I'm going to introduce in just a moment, I'm very pleased to see that Dr. Rick Greenberg is with us, and a special shout out to Rick and his team that have been working around the clock on the Johnson & Johnson vaccine. So before tonight's over, and in addition to the panel getting a chance to share their thoughts and their updates and their observations with us, I hope that we can give Rick a minute as well. That isn't to exclude all of the other physicians out there who are participating tonight, but I especially want to recognize Rick in what has been an exciting few days for the Johnson & Johnson vaccine. So let's begin with tonight's remarkable panel. Jessica Cobb is the Community Health Officer with the Lexington-Fayette County Health Department. She supervises all the non-clinical programs the health department provides, including environmental health, public health preparedness, infectious disease, community health equity and education, and health access nurturing development services. Jessica obtained her bachelor's in environmental health science from EKU, a master's in public health from the University of Kentucky, and most recently, a Master of Science in Health Information. Tara Mason is the team leader of the Lexington-Fayette County Health Department's Community Health Equity and Education team, which includes diabetes education, tobacco cessation, nutrition, wellness, and child care health consultation. She is also an active member of the Health Equity Network of Lexington. Dave Peterson is the Community Programs Manager at the Lexington-Fayette County Health Department, which includes the HANDS Home Visitation Parent-Child Education Program for infants through children age 2, and the Community Health Equity and Education branch. Dave's educational background is in exercise science, and he has worked 20 plus years as a professional in health and wellness in the YMCA of Central Kentucky, Baptist Health, and LFCHD. Last but not least, we have Kevin Hall. He is the Communications Officer of the Lexington-Fayette County Health Department, which is a fancy way of saying he is the person asking you to get the COVID-19 vaccination. He lives in Georgetown with his wife and his toddler son. Please join me in a round warm of applause for tonight's panel. And with that, we hand it over to you all to talk us through the updates, the information, the misnomers and misinformation, and everything that we need to know to be responsible community partners in the vaccination process. Thank you.
Thank you, Rabbi. I'll go ahead and get us started, as I am the professional talker of our group. Not that the other three won't do a great job, but first I want to say if we could have you all introduce us at every time we speak. That was such a wonderful, warm introduction, and I really think about what Rabbi Sabbath said about it's helping others, and that is our mission at the Lexington-Fayette County Health Department is helping Lexington be well. And our commissioner likes to talk about how he is the only physician in town who is responsible for 300,000 people and all the visitors who come in. We are really focused on making sure that it is every person in Lexington. And when we talked maybe 2 weeks ago and started planning this, one of the very first things that came out of this was how each of you can help us make sure that no person slips through the cracks. And that is really one of the most phenomenal things that you can be doing, in addition to learning about the vaccine and about COVID-19, where we are. So I hope that you're able to take some things away from this on what we are doing, and then what you can also do to help Lexington. I will say a little bit more about my colleagues here. Jessica has been overseeing our response. She's working very closely with our Commissioner of Health, Dr. Craig Humbaugh, since this started almost exactly a year ago in Lexington. Our first case was March 8th. And Dave and Tara, in addition to what was mentioned in introductions, they oversee our call center. And they don't just oversee it, they work it. They are calling people who call us with information or questions. They're helping answer that. They're also following up with people, helping them get signed up. So a lot of people who come through our clinics it's through the work of my colleagues that are on this call. And Dave, Jessica, Tara, if there's anything that I'm saying right now and you want to jump in on, please don't hesitate to interrupt. I want to say right now, the big question that we get is where are we with the vaccination rollout? So today, the mayor posted something on Facebook that 1 year ago today, we had this large meeting with city officials planning the COVID response. Now, there were no cases in Kentucky at that time as of March 3rd. I can't believe it's been a year. It seems both yesterday and 15 years ago at the same time. But since, if you told me on March 3rd that a year later we would have an effective vaccine, I wouldn't have believed you. But now we have 3 vaccines that are all showing to be effective. The best proof that we have of the vaccine being effective right now is looking at our long-term care facilities. Our hospitalizations statewide and right now in long-term care facilities are the lowest they've been since May of last year. That's important because 75% at least of the long-term care residents have received the vaccine. These were people who were at the highest risk of death, and you can see now that the vaccine is protecting them. That's why it is so important when your time comes for you, do not hesitate, get the vaccine. With the rollout today, the health department did our first phase 1C clinic. 1C, it covers about a third of Lexington, so 80 to 100,000 people, adults in Lexington. That's going to be clergy. It's going to be finance, legal, communications, information technology, reporters, any of the essential workers. So the people who've been working in our restaurants and grocery stores, keeping us fed and keeping us all the necessities, they're eligible for this. We continue to give shots to people on 1A. Those are healthcare workers. It's not as many as we've seen, but there are still a few who trickle in. And a lot of what we're hearing are, well, I waited to see how my colleagues did with the vaccine. They're fine. I want to go ahead and get a shot. Great. Come on in. We'll work you in. And then 1B, and the biggest group from 1B that we focus on are people 70 and above. And because, again, those are the people who have the highest risk of death. It's less than 10%. It's more like 5% of the cases in Lexington have been ages 65 and older. But if you look at the deaths, it's closer to 85 to 86%. So it is definitely affecting that population. So we're glad to see our mothers and fathers and grandparents getting in to get the vaccine. So for phase 1C, it covers also a lot of people age 6. It's everybody 16 and above and anybody 18 and above who have underlying health conditions of things like diabetes, COPD, people with heart conditions, obesity is one, cancer. We have this list on our website, LFCHD.org, but it covers a wide range of people. If you look at Kentucky, we are among the worst in the nation for obesity and diabetes. And between those, you've got about half, if not more, of the population that would fall in those categories. If you are interested in getting the vaccine, we encourage you to sign up for the registration at the University of Kentucky for their program at Kroger Field. We encourage you to try the state's regional site at the Kentucky Horse Park. For us, we have limited doses. We were able to do about 800 today, first-time doses. Those filled up when they went wide to the public. Those filled up in about less than 2 hours. It's an hour and 50 minutes that those filled up. They move fast. It's right now the demand is way higher than the supply, which is a great thing because we know people want it. It's also a negative thing because these aren't people we're having to get convinced to get the vaccine. These are the people who have been doing everything we've asked them to do since March of last year. They're staying in, they're wearing their masks, they're not around their families, they're not having large gatherings. They're not going to restaurants. They want the vaccine. More and more is becoming available every week in Kentucky, and more opportunities will exist. I'll also let you know, and I'm going to turn this over and let Jessica jump in here, or Dave or Tara, that be patient and keep trying. We hear repeatedly, and the call center folks may want to tell a little more on this, people who are trying, they may not be able to get in for a Walgreens appointment at 9 a.m., but they try at 11 a.m. and spots open up. So just because you try once in the day, please don't give up. Please keep trying. And finally, the last plug I'll say for us for this part is if you have questions, whether it's about the virus, it's about the vaccine, it's about how you can help, whatever your questions are about COVID-19, our call center can talk to you. It's 899-2222, or you can email. Dave, Tara, what is that email? There's so many, I'm going to blank on it. What is the email address?
COVID-19 vaccine at LFCHD.org.
Great. Well,
I'll
since
put it
you're
in the chat box.
excellent. Since you're popped up as a speaker, is there anything you want to add right now about the phases or what you're seeing in the call center?
I mean, we get a lot of calls in the call center, Dave. Sometimes we get 700 calls a day, so we're very busy in the call center. I oversee the COVID-19 vaccine emails, so we get a lot of emails, but we're here to help. We're here to answer. We're here to point people in the right direction. So if we can't get you signed up for our clinic, then we're here to point someone to another clinic where they could get an appointment.
Thanks. Hey, Jessica, I think this might be a good one for you. I'm looking at some of the questions that we talked about with Mindy ahead of time. These are things people were interested in. Are you able to share a little bit about the vaccinations that are available? For the health department, we get the Moderna vaccine, but there's also the Pfizer vaccine that's being used, and the Johnson & Johnson vaccine, which is a one-dose vaccine, is arriving into Kentucky, I believe this week. Jessica, what can you tell about the vaccinations, the different vaccines?
Sure. So we've got, as Kevin said, 3 different types of vaccine. The Pfizer and Moderna are both very similar. They're an mRNA vaccine, which is kind of a new methodology that was developed specific for coronaviruses to develop these vaccines. And the whole challenge with coronavirus is that they had not successfully, prior to COVID-19, developed a coronavirus vaccine. You know, we had seen other coronaviruses that became, near pandemics with, SARS and MERS-CoV, but those did not explode the way COVID-19 did. So we were a little bit behind when they started for vaccine development on those, and not having successfully done a coronavirus vaccine before, those were the first 2 solutions that were able to come to market. It's a little different than, a flu vaccine, because the last pandemic that we saw with H1N1, and, many people don't even realize that that was a pandemic because we weren't as frightened and the deaths weren't as, traumatic as, they have been with COVID-19. But, it was considered a pandemic in 2009. And we were fortunate enough to get a lot of vaccine more quickly with that, because they can just develop flu vaccines more quickly. They have a lot of experience doing that. As year to year, we have a, annual flu vaccine. So flu vaccines are not as much of a challenge for us. And then the third product that has just come to market is the Johnson & Johnson vaccine. And it's a little different. It's more of a traditional format of vaccine that has been used before. Some of the things that people try to compare with the vaccines are, of course, the efficacy, which means how good it works. And it's kind of challenging to compare both the Pfizer and Moderna with the Johnson & Johnson, because they were tested at different times. So as we have seen more and more, virulent strains of the virus come about, now the Johnson & Johnson has been tested, their percentage is a little lower. It's in the 60s, and the Moderna and Pfizer are in the 94 and 95%. But when Pfizer and Moderna were being tested, there weren't as many, strains that were known of. And, that in general, as far as strain typing, is a challenge, and one that we're not really the best at in the United States overall. There's many more countries that have further developed, systems to where they can get those strains typed. I forget the exact number, but very few people that actually come down with coronavirus are even going through the testing to find out what strain they have. It's only, in special cases that is actually done. And in other countries, I think it's more available depending upon where they are. So I think there's some different challenges in terms of us being able to deploy the vaccine. The Moderna is definitely a great product because it doesn't have to have the ultra low storage, the refrigerated storage that Pfizer has to have. Mostly hospitals are the only ones that are capable of storing the Pfizer vaccine. So that's where most of the Pfizer has gone. With Moderna, we can store that in a regular freezer, and then, it can be refrigerated as well for up to 30 days. The Johnson & Johnson is also similar to the Moderna, and I think it can actually go in the refrigerator. But the biggest challenge that we have overall with these vaccines is that once you puncture a vial, you have to use every single dose of it within 6 hours. So that logistically can be quite a challenge. And that's why we have processes in place at all of our vaccine clinics. We never waste a dose of vaccine. We only open, it may slow down the lines a little bit later on in the day because we're sharing a vial between a couple of different vaccination tables for people to draw from and give vaccine. But at the end of the day, we don't want to puncture more vials than we're going to be able to use. And I think in situations that we've heard about where people have wasted vaccine, they weren't really keeping control over how many vials that they had open each time. But just in general, I'm kind of the numbers person as well for COVID-19. We have seen a big decrease in cases. At one point in time, we were getting over 300 cases a day, and those days were really, really long and seemed to last forever. But we had a couple of different peaks, mostly around Thanksgiving and then New Year's again. And we stayed in that heightened period of activity throughout the holidays. But then, now we've been on a decline here pretty steadily, and other areas are seeing this as well. So we're hopeful that this, as well as the vaccine being available and, people getting the vaccine, that we're going to be able to see a market improvement and hopefully not be thinking and talking about COVID as much as we do.
Yeah, Jessica. Yeah, that was great. A couple of things I wanted to mention from what you said, because you reminded me of it as a numbers person, and talking about how difficult it is, the challenges with once you open the vial, about you making sure those doses. We can only speak on behalf of the health department on this, but it's something that I am as proud of as anything right now with the vaccine, is that we have no doses that get wasted, to the point that we had one of our clinics, we had a couple of staff members who stayed around 2, 3, maybe 4 hours because they were trying to find a vial, and they found it. Everything was okay, but this is a precious commodity and we don't want any dose wasted. So I've got some numbers to tell you, and this is on our website. We will update this at lfchd.org and every week. And in total, we have received, this is only for first-time doses, 8,950 doses. We have given 9,125. So we're not only using every dose, we are maximizing every single drop in those vials. There are things that they call them bonus doses or angel doses. And you may have heard about that on the national or local news, that a vial comes shipped with 10 doses in it, but they may have a little bit of extra. And we have been, all shot givers have been instructed that if there's extra in there, to maximize it and use it. So that's why we've given more than we've received. And people don't understand sometimes just how difficult it can be, what Jessica said about the time constraints. It's why you've heard stories about, I believe it was in the upper Northwest, power went out during a storm and people were trapped on the side of the road, and they were doing a pop-up vaccination clinic to people who were stranded in the snowstorm on the road. There was a story yesterday from, I believe is it Lincoln County, where Scott Lockhart is the commissioner. They had mass flooding, and they had some damage to vehicles and to some buildings, but they got every dose out of there thanks to help from some other health departments. I believe the National Guard may have come in to be able to help rescue that so it does not get wasted. I think one of the things that we definitely want to be able to talk about in our notes is the registration process. And Dave, is that something you'd be able to talk about? Just walk people through the registration process, and from getting a call or going online, just tell people how simple that can be.
No, absolutely. Thank you, Kevin. So yeah, the registration process is really very straightforward. We use online registration as the primary means to register our patients for the clinics. And essentially what we do is we have a link that you can go to. and simply click on that link, and then it asks you for, a little bit of information. You get to select your time. We generally book the clinics in 15-minute intervals. So, every 15 minutes, there's a block of slots available that you can register for. And so, we basically, most of the registration is done through that way. Now that we've moved into the 1C phase, which is a rather large amount of the population, this week we did something a little bit different where we put our link actually on our website, and then just notified the public via social means, social media, that sort of thing, that the link is live. You can go to our website, www.lfchd.org, and find the link and then register yourself that way. We also have a vaccine notification form that we can basically, up until this week, we were using for the group 1A, which is healthcare workers, and then group 1B, which is those who are aged 70 and above. We were having them go and use this notification form to essentially, enter their mobile phone number, enter their email, that sort of thing, and then we could reach out to them and send them the link to register. But being that the 1C group is such a large group, what we've done now is we've changed that notification form so that we're still using the notification form, but we're just going to be targeting those who are aged 70 and above with the notifications. So that way we can reach out to them and send them links when the clinic becomes available to register. And then of course they can still access it with the website, and the general public can access it with the website. The challenging thing with the clinics is that because we get the vaccine allocated in weekly amounts, and as Kevin mentioned, we get a finite amount each week, and we basically expend that allocation each week. We can't really register for the clinics, 2, 3, 4 weeks ahead of time. We're basically registering for them, week to week. So we generally open our registration for our first dose patients. We generally open it on a Monday morning. We've generally been running the clinics on Wednesdays, as we did today. There's been also times where we've offered them on a Friday as well. But once that link is open, then we just have a couple days really to register and get everybody in there. And so that's sort of an ongoing challenge, is just to let everybody know, when registration is live and available, and then get everybody registered that way. One of the things that we're also trying to really do is prioritize those who may not have means to register online, or have a difficult time navigating an online registration system. And so for those who need help registering or need a phone call to register, they can call our call center, that 859-899-2222 number. And we can take their name and phone number and then put them on a list to call. And we've got a team, Tara and I have a team of staff that can reach out and call. I think this past week we made over 100 phone calls and got through our list of people needing a phone call to register. So we maintain an active queue of people who need called to register, and we try to prioritize them in chronological order. So we reach out to them in the order that they reached out to us, to be as fair as with that we can. And we try to make sure that we're giving them a fair chance to register over the phone. So essentially that's how it goes. I mean, it's been an evolutionary process for sure, as we're moving through the different phases to find the best way to fairly get the link out for everybody to register. But as Kevin mentioned, it's a pretty easy process, and the call center is certainly there to help anybody who needs it.
One of the things, thank you, Dave, for that. One of the things to throw in, and cannot emphasize this enough, is that there is special focus on people who cannot, because of technology issues or any sort of access issues. We make sure to help them, and we've been trying to reserve slots each week so that when the clinic link goes live on our website, that there are X amount of shots that are being held for people who need to be called, or people that we are following up with, or people who call us directly, because we understand that you've got that it's not going to be a fair playing field for everyone on that. And our focus on our mission at the health department is to try to help them. I think this will be a good segue, and I've seen that the rabbis put some questions in there that pertain to this. So if you want to, do you want to read those for us to answer, or how do you want us to field those?
If you want to field them from the chat, or I'll read them aloud, either way you prefer, Kevin.
Yeah, I don't mind. I'm afraid I'm going to knock my tablet down. If you wouldn't mind reading it, that would be great.
Sure,
Be
sure
helpful.
thing. So one question is it the health department's advice that once somebody has received both doses of the vaccine and then had the necessary couple of weeks afterwards to absorb the second dose, assuming that those that need a ride are wearing masks and are healthy enough to be transported, is the health department recommending, advising, would you approve of a ride share kind of program where the vaccinated and safe help the underprivileged get to vaccination sites? And then question 2 would be, could we help with the burden of these phone calls? It sounds like a major undertaking and would be far less involved than what we call in Yiddish schlepping, taking folks from point A to point B, far safer a prospect. Can we help out by being a volunteer call center to make these phone calls, especially to those that don't have internet but might pick up the phone, to get folks registered?
Yeah, those are great questions. I think, Jessica, would you be able to tackle some of that first one about the driving and car sharing? Because I believe that's in some capacities that's already happening with people. We know that Wills is bringing some folks out there, but Jessica, can you expand on that?
Sure. I mean, it's something that in this day and age with COVID, we can't really recommend that, but there is no harm we know of if you've been vaccinated and more than 2 weeks out, and you have the immunity that you're going to have. And nothing's 100%, but you've done all that you can do to prevent yourself from becoming infected. So I think that's the best that you can do. We have had several people who said, oh, well, I just got my vaccine, but I have a 90-year-old neighbor. Can I go back and get them? And they go back and get their neighbor and bring them to be vaccinated. So I think as long as you're taking precautions in terms of masking, and it's better if it's less than a 15-minute car ride, because that's still the window of time as an exposure. Those are the things that we would probably look for.
Yeah, and I think Jessica's right. It's not something that we are not officially endorsing, saying go do this, but we know people are using that as a way of helping, particularly as more and more people get vaccinated. Dave and Tara, one of the things, and they've not heard me mention this, I don't think. One of the things I have seen some places do, there was it was a friend of mine's church in New York was telling people in the community, if you need help signing up, call us and we can help you register. Is that something that could possibly be done in Lexington instead of, and maybe it's not an official, let me back up to tell the group this. Right now, we've been working closely with the Lexington Senior Center. They have been calling members of their program, it's almost 7,000 people, and helping them register because they know the people who need the most help getting someplace or who have trouble using or no internet access. And so they're doing that in a more official capacity, helping people sign up. But Dave, Tara, what are your thoughts on being on some of the unofficial groups being able to come in to help out and get information to people?
Yeah, I think my initial thought is I think that could be an effective thing to do. Especially in a situation where you have a dedicated audience, so to say. Like the senior center is a great example. They've got a direct connection with a lot of their folks that frequent that center and a relationship with them. And it makes good sense for them to be able to reach out to them, and help get them registered. I think that absolutely is something that we can do. The system and the processes that we use are all fairly straightforward. And that I think that they're easy to adapt to different groups.
Dave, a question that came up today from someone is, I know on the site it has a social security place for a social security number. Is that something that is required upon registration, or can that be added later?
It can be added later. Yeah, that's something that's not required upon registration. That can be added later. Yes, sir.
And I think the reason I mention that is that this has likely happened is if they're calling us to help get signed up, they may not be comfortable giving that social security number to a stranger on the other end of the line, but so we can help them out once they have actually been registered in the system. We take a lot of information once they show up and get there. It's getting them the appointment is really an important piece. And so I don't forget this. There's no identification requirements. You do not need to have a valid driver's license or a proof of residence in Lexington. We do ask that you live or work in Lexington, but we are not checking. Like today, we were not asking people to show us which restaurant you worked at. We were taking it's a bit on the honor system. And also, because you're not going to know people with underlying health conditions, you're not going to ask about that. You don't have to bring a medical statement. But we've had it come up a lot, particularly if there are any people in Lexington who don't have documentation status. We don't want that to be a barrier. They can still get signed up. So if that's something you're interested in helping people, whether you know it's in your congregation, your neighbor, your family member, however you wanted to do that, and helping, you've got that link when it goes public and helping people get signed up. I think that's something that could be done. We also have flyers that are being printed. We made the final touches to them today in English and Spanish. I'll be happy to, once those are together, to get that PDF of that to Mindy so it can be sent out to anybody who needs it. You can put it in any place that you want, anybody who could need it. And anything that you can do to tell people what we're saying tonight about being patient and to keep trying. That just because, I cannot stress this enough, just because it's a place says there are no appointments at 9 doesn't mean that a little bit later that they won't open up. And then Dave also mentioned about how we went public with 1C with the link on our website and pushed it out through social media. We don't have a set time right now where it's not like a concert ticket where Ticketmaster has them on sale at 10 a.m. in your city. It's so much dependent on what we are able to do behind the scenes to make sure everything is ready. I would just advise you or to tell people to be watching on Monday because that is when it has been going either publicly live on our website and social media or in a blast email that's gone out. So Monday is the day to be watching for that if you know of people who need the vaccine. But those are great questions and really goes into what this all started from, is how you can help get people protected on this.
And I would just add, Kevin, that one of our biggest challenges with deployment of this vaccine is that when we get the vaccine, we have to deploy 90% of it within a week. So that really cuts the timeline down for us in terms of us being sure that we're actually going to get it and actually having the clinic to schedule people and get the vaccine out there. So that's part of the problem that we've run into as far as helping the underserved and doing a lot more phone calls is because, you call people and you reach maybe 40% of them, you leave messages, they got to call you back. Do they reach you? And, it's a lot of back and forth. So that's, some of the challenges that we've seen in doing that, knowing that some people still do need that resource. I feel like we consistently have panicked and said, oh gosh, we have to put out a link because we only have this many people scheduled and we don't have any more time to make calls. So I think that that'll be important in the, future, in the near future, hopefully when the vaccine availability and the supply is better. Because that way we won't have as much pressure to be getting rid of it as quickly as we get it, because it's not storage room. That's the, the factor here. And, with H1N1, when they were sending pre-filled syringes, that stuff does take up a lot of room. This, we can store, it's in multi-dose vials. It's very compact and, we have a lot of room to store it, but just the pressure to be able to deploy the vaccine, which is good because we need more people to get vaccinated. It's just more difficult for us to really hone in and target those underserved populations and people that have challenges with technology.
And one of the things the mayor's office is working with the University of Kentucky on are some mobile pop-up vaccination clinics. I think now they've done 2 weekends and they're doing about 500 shots over the weekend. Those are all done through the mayor's office. So if that's something, I would encourage you to talk to your city council members. And if you have ideas or if you know of a place that could possibly benefit from a larger clinic like that, we talk to the council members on a regular basis, either through email or regular Zooms. So they're not in the dark on this. And that's something I would encourage you not to be shy about that, and to ask us questions as well and share ideas that you may have. We've been doing this for the vaccination clinic since December 23rd was our first one. So a few days in mid-December, we started planning, and a fresh set of eyes can lead to some new ideas. So don't be afraid to shoot some messages our way with, well, have you thought of this? Doesn't mean we'll do it, but we can get some consideration, and it may spring another idea to mind that will be effective.
Okay, yeah, we've got about 15 minutes left, and we had a couple of questions come in. One of them was someone knew somebody that already had COVID. Can they come in and get a vaccine? And are efforts being made to clarify that possible misconception?
Yes, that's for the most part, yes, they can come in. And Jessica, you may have more information on this. If they've received a certain treatment, and I cannot for the life of me right now remember what that is called, there's certain sort of a treatment that would make them not eligible for 90 days. Do you, Jessica, Tara, or Dave, do you recall what that is offhand?
No, but I think that would be something that you would have to have in the hospital. So you would have had to have been really sick with COVID, and then the
Mindy,
90 days
question.
I know what it is. It's called BAM infusion.
That's it. Yes.
We got it. And that's our big question. How to get back in to get the next vaccine.
Right. And that is recommended. Dr. Humbaugh, Commissioner of Health, I talked to him today to answer that when that came in. It is recommended that you wait 90 days. But for everybody else, most people, the vast majority, as Jessica said, who are not hospitalized, you can go ahead. Once you're not, you're not being isolated, you're not infectious, and you're allowed to go back out in the public. Please do not come to our clinic or any clinic while you're still infectious, but you can still get the vaccine if you've had it.
And there has been, Dr. Humbaugh elaborated a little bit that, you may want to, think about the timing. If you've recently had COVID and you think that you still have some natural immunity, it's tough to say how long you would have natural immunity, depending upon your, progression of illness and, a lot of other factors. But, some people may want to wait a little bit after they've had COVID and then, use that natural immunity and then get vaccinated and have the immunity from the vaccine. And that way you're protecting yourselves, because that's the thing, is that we're still all in a study. Even though a lot of us have been vaccinated, the long-term effects of the vaccine haven't been tested yet because simply not enough time has elapsed. So I think there's more testing to be done, and there will be future recommendations in terms of booster doses or, additional vaccines that could afford more protection as time goes on. And that's just the way science works sometimes, is that, it doesn't work as quickly as, we would like. And unfortunately, that's kind of the situation we're in.
Yeah, Jessica brings up a great point, and Dr. Humbaugh mentioned this yesterday to our staff. Similar question came up, is so much of this, the answer is we don't know. And we know that's not necessarily sometimes what the public wants to hear, but it is the honest answer. And the answer you're going to get from the health department every time is the honest answer. We don't know if this is going to be 3 years from now, a year from now, 9 months from now, will you have to get another dose, as Jessica mentioned? Will there be another booster dose? We don't know if this is going to cover the mutated, the new strains that are coming in, and the more that will be coming in the future. So much is unknown on that. What we do know, though, right now is that it is effective for the primary strain that we're seeing in Lexington. And I think a question that came up earlier was, have we seen any of the new strains, any positive cases in Lexington? I've not heard of any. Jessica, do you recall of any that have come up? Jessica is on calls. I don't know how she does it. There are 24 hours in a day, and 28 of those she's on phone calls. So I think has that come up on any of those?
It has, and unfortunately that kind of runs into the challenge of not enough typing being done. because, even though you tested positive for COVID, you don't know what strain that you've had. And it's probably not going to come about as something that you would get tested unless you're very, very ill. And even then, it's not as available so that anyone who wanted that could get testing. So we haven't, I haven't heard of, particular strains that you found locally, but that's just one of the challenges that exists with the system and not having that information available. Where those strains are from is just simply where they were first identified. Doesn't mean it started there, maybe not. That's just one of the challenges that exists with this disease and others that rely on the strain typing.
And Jessica, this may be one better suited for you. The question was, what is being done locally about reporting adverse reactions? I know for the health department, so of the 9,000 or so we've had, there have been, I'd say, fewer than 10. Would that be about accurate, Jessica, of any sort of reaction at all? There have been some mild reactions to people. We also tell everyone who comes through our clinic, we go through the checklist. If they've had any reactions to a shot in the past, including their first dose, or they have any sort of allergy, whether it's there's a shellfish allergy or an egg allergy, we ask them to wait inside for 15 minutes so they can be monitored as needed. Everyone else can go out to their car and they have a sign and they honk the horn if they need anything. We also have EMTs and firefighters on site to help. And I believe every person also on their vaccination card, there's information about how you can report your side effects and reactions. So it goes into the national database as well. But do you have anything, Jessica, more in depth about adverse reactions here?
Yeah, vaccine adverse reactions are reportable. So that's something that if somebody contacts us back, then we would report that information to the CDC. There's a whole vaccine adverse event reporting system that we have to go through and report those events. They don't always happen immediately after somebody gets the vaccine, but often, we've had people contact us back, and I guess I wouldn't say often, but when people have an adverse reaction, they contact us back and we make sure that information gets submitted. The other system that Kevin's referring to with the CDC on the cards is there's an electronic system that will send you messages and ask you to fill out a survey form. So, how are you feeling the day you got your vaccine, the next day, and so on and so forth until you don't report any more adverse symptoms. It's kind of a different experience for everyone. And I think that they're looking to collect more information, not necessarily about adverse vaccine events, but just the general experience. And hopefully that way that they can convey a true experience of what people are experiencing when they get the vaccinations, because this is a new vaccination and it is different for everybody.
Jessica,
Yes.
would you recommend the CDC's Be Safe app, people to use that?
Yes, and I actually did it, and it was very easy to use, and they didn't sell my number to any telemarketers that I know of. So it was just an easy system. It took less than a couple minutes to fill out that little survey, and it does really help collect data. They depend upon people to people who aren't having large reactions to be able to supply data for that, and that does again kind of help people understand what the experience is when people get vaccinated.
I'll add too that in the call center, since we've been doing the vaccinations since late December, we've had extremely few people that have called and said, hey, I got a vaccine and I'm having this strange, possible reaction to it. What do I do? It's been extremely minimal, at least from the report. This is just all anecdotal from people calling the call center, but it's very rare that anybody ever reports anything to us.
One of the questions that came in was, does any of the vaccines have shellfish in them? And again, Jessica, I think this may fall to you. My understanding is that they do not. It's asked though if you have any sort of if you've had a reaction to basically any sort of food or previous shot. It's just extra precautions to make sure that you don't drive out and have a reaction on the road. We want to keep people there just because they may be more prone, I guess, to an adverse reaction just because of their history. But there's not, to the best of my knowledge, and Jessica, as are you aware? There's no shellfish in the vaccines themselves.
No, you're right. We do use that as an indicator to recommend people wait 30 minutes if they've had a previous reaction, an anaphylactic reaction to anything else, whether it be a vaccine or something like shellfish, food allergy or what have you. So they wait 15 minutes inside and then another 15 outside. If they want to wait 30 minutes inside, that's okay. We'll allow that, but it's just whatever anybody's comfortable with. And we have had, knock on wood, very few reactions that occurred immediately, but luckily we do have the EMTs and as well as nursing staff on site to be able to help, with that, if that occurs.
So do you?
Pardon the intrusion. I hope that Mindy and Paula will forgive me, and I want to thank our panel again. I hope everyone's gotten a chance to talk at least once, but I do want to take advantage of having Dr. Greenberg on the call. He's posted something in the chat, but as he's been working on the Johnson & Johnson vaccine locally here at UK and with other community partners in town, I wanted to give Rick a chance to tell us a little bit about that newest of safe vaccines. Rick?
Thank you, Rabbi. The University of Kentucky, along with Baptist Health in Lexington and Norton Healthcare in Louisville, enrolled about 890 individuals in the main trial, the 3001 for Janssen. That was the main part of the submission that has gotten them the EUA. So, and that number was actually the largest enrollment number in the world. So not only is UK #1 in basketball, and it is the 1927 Yankees in vaccine studies at the moment. So we were asked by Janssen to join their 2-dose versus 1-dose study, and that's what I posted. So we are now doing the 2-dose versus the 1-dose. In this trial, eventually there'll be no placebos. Everybody will get a Janssen vaccination. The enrollment is restricted to people 60 and older, and that will be for Thursday and Friday of this week. And then starting on Monday, it will be restricted to 18 and older minorities and ethnic groups. And that will finish out the enrollment probably in the next couple of weeks. Individuals who enroll in this study will get either 1-dose or the 2-dose separated by 57 days plus or minus. So it's a 2-month. It's done for completeness sake. It probably isn't necessary right now to get 2 doses of the Janssen vaccine because 1 dose works very well. And I do want to compliment our health department. You all were terrific. Your knowledge is as close to perfect and better than mine, and something to be proud of in our city that we have such good professionals handling all of this with such great care and consideration. But there's a little bit of challenge on our part to get some enrollment. So if anyone is interested in definitely getting a Janssen vaccination, I put on the chat both our website and my email. You only have about 48 hours to go through this. We have 14 openings, and then we will switch to the 18 and older ethnics and minority groups. So thank you, Rabbi, for letting me speak, and I hope the 30 people that listen in are still there and really excited about getting either the vaccine through the city and state, or if they certainly just want to get a Janssen vaccine, come to us. Thank you, Rabbi.
Thank you, Dr. Greenberg. Okay. All right. Well, I think we've just about come to the end of our hour here. I want to thank Rabbi Wirtschafter, Rabbi Sabbath for being with us tonight. And thank you, panel, Kevin, Dave, Tara, and Jessica. Highly informative presentation. And I don't think I'm speaking out of turn when I say on behalf of our community, we thank all of you and everyone at the Lexington-Fayette County Health Department for your hard work and dedication. You put yourselves at risk every day to help others, and your acts of bravery and selflessness will be remembered always. You give true meaning to Tikkun Olam as you work to heal the world and make it a better place. You can find all of their information, phone number, email, website on the Jewish Federation website, jewishlexington.org. So you can find all that information there. I have a couple of announcements before we close. If you or someone you know needs help in registering, or if they need help in getting to a vaccine appointment, JFS can help arrange for someone in the Jewish community to assist you. The contact information is there on the screen, my phone number and email. Call me at any time. Let me know if anybody needs assistance. And then if you would like to be a volunteer to help the seniors in our community, contact me by phone or by email again. And just remember that volunteers should have both doses of the vaccine, 18 years of older, have a valid driver's license and a current car insurance. And you have to agree to adhere to the CDC COVID-19 prevention guidelines. Like I said, you can find all this information. The Jewish Family Services Resource Roundup that we sent out recently on the website, and any updates as well as a recording of this program will be shared later this week. So thanks again, everyone. Enjoy the rest of your evening. Take care. Thank you.
Thanks for having us.